It's August 10th, 2023. The time is 1:30 p.m. I'm calling this meeting in order. In attendance are Commissioners Matari and Duncan, and potentially Commissioner Brooks will join us by telephone. Are there any changes to the agenda? No. Okay, then we'll go ahead with our quarterly update with District Director Don Duffy, and we have Eric Kettner as well.
Well, thank you, Commissioners. It's great to be with you again this quarter. I've got a lot here, but not that much to say. But I did want to give to you, you might find this interesting, is this is the 5th edition of what we call the Spokane Valley Rathdrum Aquifer or Prairie Aquifer Atlas. I find this very interesting, so I brought a copy for each one of you. We're involved in this process to produce this every once in a while, but none of our resources go into producing this, but it's a wonderful document that gives some great history and information about the aquifer that you have helped us to protect. And I just wanted you to have that, and it's interesting information for sure. So a couple of things just to go over with you here today. Things are going well at the Health District. We appreciate Dr. Johnson, who's now on our Board of Health. Unfortunately, he had to miss the last meeting. I think he had some important issue that he was already scheduled, but I'm sure he'll be an active member of our Board of Health. In the first meeting where he attended when he was confirmed, very knowledgeable, brought great information and a new perspective to the board. I also very much appreciated that he certainly has his thoughts on certain things, certainly regarding the health and welfare, but he's also one I think that brings he brings coalition to the group. I think we can work together and collaborate very well with him. So thank you again. I'm sure he'll be a good addition. Just a couple of things regarding the Health District that I wanted to chat with you a little bit about today is, first of all, regarding our food establishment fees. We have been working, all of the districts around the state, to discuss this. It is in statute in the state of Idaho that the health districts have the regulated authority to go out and inspect food establishments. Also in this statute are the fees that we can charge to do that. And the last time, and they're very specific in the statute, and I've got copies of that if you're interested. But they're very specific in the fees that we can charge. Well, the last time those fees were done, I believe it was 2018. Is that correct, Eric? Yeah. And obviously our fees have gone up, our cost to do those food establishment inspections have increased. And as of now, in the 5 northern counties, well, specific to Kootenai County, our expenses exceed our revenue by nearly $200,000. So that means that cost is obviously now borne by our counties. So we're working, we've been working with the Idaho Association of Counties, we've been working with some elected officials. Our hope would be that those fees could be removed from statute, leaving it up to the county commissioners to decide what those fees are. Any fee that we implement at the health district has to be approved by our Board of Health, or really our county commissioners. So it would be up to all of you to decide what those fees would be. And so we're hoping that that can be removed from statute. We're trying to find an elected official who's willing to champion that. There's a few that we've been talking to. But it is a cost, again, that's borne by our counties, and it's time to, we believe, to increase those fees so that we can cover it. We understand that the margins are very, very slim in an establishment, and I think we need to be sensitive to that. And maybe there's an argument for we don't ask them pay for all of it, but maybe a part of that. We have reached out to the food lobby, and obviously they're concerned that those fees would go up, but they're listening. And so just more to come on that. And in fact, I have here for you, this is, you'll see this by county here. You'll see that 200,595 number specific to Kootenai County. You might find that interesting. Those On this particular document, you'll see some codes there, 16520 and 16521. Those are just codes we use to post those expenses toward. So just letting you know that we're working in that direction. We'll see what that outcome is. Also, I wanted to give to you, I should have given this to you when I was standing. We have, just to give you an idea of what's happening with septic tanks over the last few years. Kind of see the volume of work and problems. This is the last handout.
Thank you.
Okay.
And you can see on this document, you can see a history. There's the first graph is for the entire health district, so for all 5 northern counties. And then the bottom graph is what's happening here in Kootenai, and you can see that. And the blue are the new permits that were issued. And you can see a big jump in 2021 and 2022. And a pretty significant drop in 2023. This is our fiscal year, which runs from July 1 to June 30. So this last one here ended June 30 of 2023. So they're all comparing year to year in our fiscal year. And still a lot. I mean, there's still a lot of permits being requested, but certainly a drop compared to what we saw in that 2021 and 2022.
Okay. And this is not broken down by aquifer, it's just total.
Correct. Just total in Kootenai, correct.
Okay.
And then one other item, just to let you know, one of the things we're dealing with is not a significant issue, I just want to make you aware of it, is as you know with House Bill 316, all of our 19% of our budget now comes from our counties, when that was split at one time between the county and the state. Yet the state has continued to ask us to do things which we would call unfunded mandates. And we're saying no to those unless there's some funding that comes through. And 2 of the more recent ones is with our harmful algae bloom. We've had a relationship with the Department of Environmental Quality where they do the analysis and then we report out to the community, and they have said we don't have the staff to continue to do this and we'd like the health districts to do more of that process. Now we have a great relationship with them and we've worked that one, I think, out sufficiently as it stands today. But again, coming to us, the state doesn't have the money, and so they're asking us to get involved. But one that concerns me even more is, as you know, as I just mentioned, we do restaurant inspections, and the state has come forward, who has the regulatory authority for assisted living facilities, is coming to the health district saying, not only do you need to investigate restaurants, but could you please also examine the kitchens in assisted living facilities throughout the 5 counties? We understand that that's very important and should be happening, but if they're going to ask our staff, who has the skill set to do this, there has to be some funding coming from the state for us to do that. Otherwise, it's just going to be borne by our counties to do that work. So we have said no in the sense that we're negotiating with them, but unless there's some money that comes forward. And I have some concerns about more of those kinds of things coming our way. And again, there is no funding coming from the state on those issues. So we're comfortable where we are right now, but I wanted you to make you aware if you hear anything about that on your end.
Okay.
And that's the end of my report that I have for you today. Most importantly, I'm here with any questions either one of you might have for me.
Bruce?
Yeah, I'm just curious, what is your cost to inspect an establishment at the per unit level?
Yeah, very good question. So I'm going to give you, Commissioner, this, and we'll walk each other. In fact, I'm going to have Eric walk you through this. But this is actually the state statute, and it's very specific what those fees are.
Thank you.
Commissioner, if I may, prior to going through this document, we can break and have broken down the per establishment fee. They're frankly fairly close. And I don't have those numbers in front of me, but across the 5 counties, those numbers deviate by about $30 per inspection. And we can certainly provide that to you if you would like that. But as Don's stating, the short answer is that the fees that are set in statute that we must charge do not remotely cover the cost of that inspection.
Yeah.
We've estimated that what fees are in this statute are covering about 50% of our cost.
And to add on, this, in previous discussions with the lobbyists, some of their concern was that they believe that this is a public health matter and thus should be partially funded by taxpayer dollars. Among the 7 health districts, though, there's different philosophies on what that percentage should or should not be. Thus, it makes sense that the commissioners of each county or of each health district would be the ones making that decision.
I'm just curious why the state gets involved with setting your fees if the fees have to be reflective of the costs, and they probably don't have a recurring process.
Food lobbyists,
Yeah.
food industry lobbyists is exactly
Commissioner
why.
Duncan is on track on that.
Yeah.
Commissioner Matari, there have been some concerns, if you have the same owner of a restaurant has a restaurant in North Idaho and one in Boise, that fee should be the same and shouldn't be changed, but the costs are so different from county to county, or at least if not district to district, there would be no reason that those could not be different, right? But that has come up. But Commissioner Duncan's right. The food lobby is doing their best to hold those at bay, and frankly, they've done a good job of that.
Yeah, it is one of, I think, the only program where we don't have the flexibility to regularly assess our costs and then go to our board and say this is a more appropriate fee to cover the cost.
So we had that as an example of that is our septic tank permit fees. So a little over a year ago, we raised those fees, but we had to take that to our Board of Health to approve that, which includes really that they represent our county commissioners. They're making that decision. So we'd like to be able to do the same with our food establishment fees.
Do you know how many times last year you actually visited establishments?
We, by rule, we are obligated to visit each facility at least once per year. However, some facilities receive multiple inspections, and in the event we have to do a follow-up to verify correction of violations. We also, complaint investigations get us out to facilities more frequently.
Any idea how many we have done,
We have,
say, in a year?
we have around 1,350 to 1,400 facilities. I would say we do between 1,700 and 2,000 inspections a year if I had to guess.
Okay. That's it for me.
I had a question. You just have the different codes that you talked about for internal reporting. Do those codes mean anything as far as, alcohol establishments or just food only, or?
No, the breakdown is 16,520 is specific costs related to inspection of the food establishments themselves. 16,521 is accessory activities such as we teach the Serve Safe class,
Okay.
plan reviews. So
Gotcha. One's inspection, one's ancillary.
absolutely. Yeah.
Okay. Fantastic. Anything else?
No, that's it. Thank you.
Okay, yeah, I think we're good. So I guess I would ask for public comment. Anybody? No? Bill, did you make it on the line? All right, 1:45, meeting adjourned. Thank you.
Great, thank you
Thank
so
you.
much.